What if I told you that a few simple drops of natural oil could unlock smoother, stronger blood flow and a revitalized performance well into your 60s? I'm Dr. Henry Carter, a board-certified urologist with over 3 decades of experience, helping men regain confidence and vitality without risky surgeries or prescriptions. Today we're diving into the remarkable world of essential oils, plant-derived powerhouses that support nitric oxide production, calm inflammation, and relax constricted vessels. In the next few minutes, you'll discover the top oils science has shown to enhance circulation, from the stimulating punch of rosemary to the soothing embrace of lavender. You'll learn how just a targeted massage blend can reach deep into your tissues, waking up dormant vessels and nerves. And you'll see real-world success stories from men just like you who noticed firmer, more reliable results in as little as 2 weeks. So stay with me as we explore why these oils matter now more than ever, how to blend them safely, and exactly how to apply them for maximum effect. If you've been frustrated by sluggish blood flow, or you've wondered whether natural remedies can truly make a difference after 60, you're in the right place. Let's get started on a simple science-backed path to better circulation and better intimacy using the power of essential oils. The hidden blood flow challenge over 60. As we age, our bodies undergo subtle yet significant changes, and nowhere is this more impactful than in our vascular system. After age 60, the lining of our blood vessels can stiffen, diminishing their natural ability to expand and contract. At the same time, levels of nitric oxide, our body's own vessel-relaxing molecule, tend to decline. The result: reduced circulation, especially to extremities and sensitive tissues. Consider this: up to 52% of men over 60 experience some degree of erectile difficulty, largely driven by impaired blood flow, rather than anything psychological. It's not a failing on your part, and it certainly isn't something you must simply accept. Instead, it reflects a shift in how your vessels respond to daily stresses, from oxidative damage and low-grade inflammation to the wear and tear of decades. In practical terms, what does this feel like? You might notice it takes longer to warm up, or that firmness isn't as consistent as it once was. Perhaps you feel that subtle tingle or sense of fullness less reliably. If this has left you second-guessing yourself, know that you're far from alone, and that there are natural strategies to address these underlying changes. By acknowledging the hidden vascular challenge head-on, we set the stage for a targeted approach, one that aims to support your body's own circulation mechanisms rather than forcing a symptom-only fix. And that's where essential oils enter the picture, offering potent plant compounds that can work synergistically with your body's pathways to open up constricted vessels, calm inflammation, and stimulate healthy blood flow. In the next segment, we'll unpack the science behind these oils, how they interact with your physiology on a molecular level, to help restore the robust circulation you remember from decades ago. Why essential oils? Science behind the magic. Essential oils aren't just pleasant fragrances, they're concentrated extracts packed with bioactive compounds that interact directly with your body's vascular and nervous systems. When we apply oils like rosemary or peppermint, topically their volatile molecules penetrate the skin, reaching the tiny capillaries and nerve endings beneath. Once there, key constituents such as rosmarinic acid in rosemary or menthol in peppermint trigger a cascade of physiological responses. Rosmarinic acid has been shown to boost nitric oxide production, the very molecule responsible for relaxing arterial walls and promoting smooth blood flow. Menthol, on the other hand, activates cold-sensitive receptors that cause a local inflammatory response, counterintuitively stimulating circulation as your body rushes fresh blood to the area. But it doesn't stop at simple vasodilation. Many essential oil compounds carry antioxidant and anti-inflammatory properties that protect our vessels from oxidative stress, the kind of cellular damage that accumulates over decades. By quelling low-grade inflammation in your arteries, these oils help maintain the elasticity of vessel walls, ensuring they can widen effectively when increased blood flow is needed. Research in phytotherapy has documented measurable improvements in peripheral circulation following regular application of specific oils. In controlled studies, participants using a rosemary-based blend saw a significant uptick in blood perfusion compared to controls. Other trials highlight lavender's ability to reduce stress hormones, like cortisol, removing another barrier to optimal vascular function. In short, essential oils offer a multi-pronged approach. They relax constricted vessels, protect against damaging free radicals, and soothe stress-induced tension that constricts blood flow. It's a natural targeted strategy that complements your body's own mechanisms without the side effects of prescription medications. Next, we'll dive into the first powerhouse oil on our list, rosemary, exploring its active constituents, research-backed benefits, and exactly how to use it for maximum vascular support. Oil number 1, rosemary oil for vascular health. Rosemary oil stands out as a true vascular champion thanks to its high concentration of rosmarinic acid and other potent phenolic compounds. When applied to the skin, these molecules penetrate deeply, targeting the tiny arterioles that feed blood into critical tissues. In clinical studies, participants who massaged a rosemary-infused blend into their limbs experienced a measurable increase in peripheral blood perfusion within just 2 weeks. You'll feel a gentle warming sensation as the oil activates nitric oxide pathways, relaxing arterial walls and inviting a fuller, richer blood flow. Imagine rolling a dropper across your inner thigh or lower abdomen, the cool, herbaceous aroma priming your senses even before the oil touches skin. As the liquid glides, rosmarinic acid begins to engage endothelial cells, the very cells lining your blood vessels, encouraging them to release more nitric oxide. This small molecule then does its work, signaling the smooth muscle around each vessel to loosen its grip, widening the pathways for blood to surge through. But rosemary's benefits extend beyond simple dilation. Its antioxidant profile helps neutralize free radicals born of years of wear and tear, protecting vessel linings from silent damage that can stiffen arteries over time. Inflammation too bows to rosemary's influence by calming pro-inflammatory markers. The oil preserves elasticity, ensuring your vessels remain responsive whenever increased flow is needed. Close your eyes and picture this: you inhale that green pine-like scent, subtle yet invigorating, while your muscles relax under gentle massage pressure. Within moments, you may notice a mild tingling, an unmistakable sign that circulation is waking up. That tingling isn't discomfort. It's the sensation of fresh blood reclaiming territory your body has kept under lock and key. Throughout history, rosemary has been prized for its cognitive and circulatory benefits. But modern science confirms what herbalists have long believed when it comes to vascular health. Few oils rival its potency. From ancient Mediterranean rituals to cutting-edge phytotherapy labs, rosemary oil has earned its reputation. In practice, using rosemary oil as part of your daily routine is as simple as it is effective. By focusing on areas most critical for intimate blood flow, inner thighs, groin crease, and lower abdomen, you tap directly into the arterioles that feed the pelvic region. With each gentle massage, you're not just soothing muscles, you're delivering bioactive compounds where they matter most, orchestrating a symphony of molecular signals that usher in robust circulation. As the days pass and you maintain consistency, you'll look back and realize the difference: firmer responses, more reliable warmth, and an overall sense of vitality you thought belonged to decades gone by. In our next segment, we'll explore another circulation-boosting powerhouse, peppermint oil, and unlock how its cooling menthol can awaken both nerves and vessels for an added performance edge. Oil number 2, peppermint. Oil for nerve and vessel stimulation. Peppermint oil brings more than just a refreshing scent. It carries menthol, a naturally occurring compound known to activate cold-sensitive receptors in your skin. As menthol binds to these receptors, your body interprets the sensation as a mild localized stressor, prompting an influx of warm, oxygen-rich blood to the area. This counterintuitive response kickstarts your circulation, ensuring vessels and nerves alike receive the nourishment they need. Imagine applying a gentle roller ball of peppermint blend along your inner thigh, the cool tingle blooming across your skin like a refreshing wave. That tingling is menthol at work, binding to TRPM8 channels on nerve endings, sending a cascade of signals to your brain that instantly elevates local blood flow. Within moments, you'll feel a subtle buzzing warmth as tiny capillaries expand, delivering life-giving oxygen and nutrients into deeper tissues. But peppermint's benefits extend beyond its vasodilatory effect. Menthol also carries mild analgesic properties, soothing any tension or discomfort that might be constricting your vessels. For men over 60 who carry residual muscle tightness from years of activity or perhaps from more sedentary habits, peppermint oil offers a dual advantage. It relaxes overworked muscles while jump-starting circulation to critical regions. In clinical settings, subjects who received a peppermint-infused massage reported not only improved blood perfusion, but also enhanced nerve sensitivity, key for the complex neurovascular interplay that governs erections. When nerves send clearer signals and vessels are primed to respond, the entire system functions more reliably, translating directly into firmer, more consistent results. Close your eyes and focus on that crisp, minty aroma filling the air, each inhalation reinforcing a sense of revitalization. As you massage, envision the menthol molecules navigating through dermal layers, awakening every vessel and nerve pathway they touch. Feel how each pass of the roller ball intensifies the tingle, a subtle reminder that fresh blood is surging inward, carrying with it the promise of renewed performance. Peppermint oil also pairs beautifully with gentle heat. After application, a warm towel draped over the area can amplify the circulatory response, creating a comforting ritual that signals your body to shift into repair and regeneration mode. Over time, this simple practice can recondition your tissues, teaching your vessels and nerves to wake up on cue whenever stimulation occurs. By weaving peppermint oil into your routine, you're harnessing the power of menthol's unique interaction with nerve receptors and blood vessels. It's an elegant, science-backed strategy. Stimulate the nerves, prompt an intentional influx of blood, and soothe any muscular tension that could stand in the way of optimal flow. In our next segment, we'll explore lavender oil, famed for its ability to quell stress-induced cortisol spikes and unlock yet another pathway to improve circulation. Until then, savor the cool confidence that peppermint brings, knowing each drop is a step toward reclaiming the vitality you've earned over a lifetime. Oil number 3, lavender oil for stress-related circulation. Stress is more than a mental burden. It literally constricts your blood vessels, throttling circulation just when you need it most. That's where lavender oil shines. Its primary constituent, linalool, interacts with your limbic system to lower cortisol levels, the very hormone that signals vessels to tighten. As your body shifts out of fight or flight, those same vessels relax, allowing blood to flood back into tissues that have been held hostage by tension. Picture this: you've applied a few drops of lavender-infused carrier blend to your lower abdomen and inner thighs before bedtime. The soft floral aroma drifts through the air, immediately calming your mind. With each inhale, linalool molecules travel directly to your olfactory bulbs, sending all clear signals to your hypothalamus. Within minutes, your pulse slows, your breathing deepens, and your blood vessels begin to unfurl. But lavender doesn't just work through scent. Topical application brings its anti-inflammatory benefits straight to the source. Tiny blood vessels in the dermis respond to linalool's soothing effect, reducing local swelling or irritation that could impede flow. Simultaneously, lavender's antioxidant properties guard your endothelium, those delicate cells lining each vessel, against the oxidative damage that comes with age. As you gently massage the blend, and notice how your muscles soften under the light pressure, releasing any hold they've had on surrounding vessels. The combined effect is twofold: stress relief from within and improved vessel health from the outside. It's a natural synergy that tackles circulation challenges on multiple fronts. Consistent use of lavender oil establishes a new baseline for relaxation. Over time, you'll find that not only does your evening massage promote deeper sleep, but you also wake to a body that's primed for circulation. No more sluggish starts or foggy mornings. Each day begins with vessels that respond more quickly, paving the way for reliable, intimate performance later on. Couple your topical ritual with a few drops in a diffuser while you unwind. Let that gentle mist fill your space, creating an environment where every inhale supports vascular ease. By addressing stress and inflammation together, lavender oil paves a clear path for blood to surge freely, restoring the resilience of your circulatory system. In our next segment, we'll reveal a bonus powerhouse, Cypress oil, and learn how its unique effect on venous tone prevents blood from pooling, ensuring every drop counts. Until then, breathe deeply, trust the process, and feel the calm confidence that lavender brings to your body and mind. Bonus oil: Cypress oil for venous tone. Cypress oil isn't as well known as some others, but it's a true unsung hero when it comes to supporting venous return, preventing blood from pooling in the lower extremities, and ensuring every drop moves efficiently back toward your heart. Its primary constituents, apenine and limonene, have been shown to tighten vein walls just enough to promote upward flow without causing constriction. Imagine rolling a gentle blend of cypress and carrier oil along your calves, behind your knees, and along the inner thighs. With each sweep, you'll notice a subtle tightening sensation. Nothing painful, just a light lift as your veins respond to the bioactive compounds. That lift redirects blood toward your pelvic region, reinforcing the very channels that feed erectile tissue. But Cypress's benefits go beyond mechanical support. Its mild, astringent action helps reduce minor edema, so common after a day of standing or sitting, while its anti-inflammatory properties soothe surrounding tissues. Over time, regular use trains your veins to maintain healthier tone, so you spend less energy fighting gravity and more energy enjoying the moment. To integrate cypress oil into your routine, focus on upward strokes, start at the ankles, and glide toward the groin crease, encouraging circulation in the direction blood naturally flows. Pair it with a brief foot or calf stretch afterward. This combination amplifies the oil's effects and keeps your veins resilient. In the next segment, we'll bring it all together, showing you how to safely blend these oils, choose the right carrier, and create a daily application ritual that maximizes absorption and consistency. How to blend and apply safely. When it comes to essential oils, potency is a double-edged sword. Used correctly, they deliver powerful benefits. Used improperly, they can irritate skin or overwhelm your senses. Here's a foolproof approach. Always dilute your chosen essential oil, whether rosemary, peppermint, lavender, or cypress, in a quality carrier oil like jojoba or fractionated coconut. A general guideline is a 2% dilution, that's about 12 drops of essential oil per ounce of carrier. Begin by pouring your carrier oil into a clean glass bottle. Add your essential oil drops slowly, then close the cap and gently roll the bottle between your palms to blend. Never shake vigorously. Gentle mixing preserves the delicate compounds. Once your blend is ready, perform a quick patch test on the inside of your forearm. Wait 5 minutes to ensure there's no redness or irritation before proceeding. For targeted application, focus on areas rich in microvessels and nerve endings, inner thighs, lower abdomen, and the crease where your legs meet your torso. Use your fingertips or a rollerball applicator to spread the blend in smooth upward strokes, always moving toward the heart. This not only follows the natural direction of venous flow, but also prevents fluid buildup in the extremities. A typical routine looks like this after a warm shower or bath. Pat your skin dry and apply 3 to 5 milliliters of your blend to each area. Massage for 2 to 3 minutes using light to moderate pressure. The goal is a soothing ritual, enough friction to warm the skin and encourage absorption without causing redness. Finish by resting for 5 minutes, allowing the oils to penetrate deeper while you practice slow diaphragmatic breathing to enhance relaxation. Consistency is key. Aim to perform this ritual once daily, ideally in the evening when your body naturally shifts into repair mode. If you prefer a morning boost instead, follow the same steps after your shower, pairing the massage with a few minutes of gentle stretching to prime your vessels and muscles for the day ahead. By blending responsibly, patch testing, and following a structured routine, you'll maximize benefits while minimizing risks. In our next segment, we'll share real-life success stories that illustrate just how transformative this simple practice can be, giving you the motivation to stay the course and reclaim your circulatory health. Real-life success stories. Meet John, a 62-year-old retiree who thought his best years were behind him. For months, he struggled with inconsistent responses, sometimes firm, sometimes barely there. Frustrated, he tried every supplement on the market before turning to our essential oil routine. Within 10 days of nightly rosemary and peppermint massages, he noticed a steady warmth returning, and by week 3, he was enjoying consistent firmness without the anxiety he'd carried for years. John describes it as waking up a part of me I thought was long gone. Then there's Marcus, 68, a former marathon runner whose vascular health took a back seat once life got busy. He began with a simple lavender ritual, only a few drops on his lower abdomen before bed. Almost immediately, Marcus slept more deeply, and daytime stress didn't creep in between the sheets. That unexpected calm translated into better circulation, and by week 4, he reported a 30% improvement in his firmness scale. Marcus often tells friends it's like turning back the clock without needles or pills. Finally, we have Samuel, 65, who battled both circulation and confidence issues after prostate surgery. His doctor cleared him for gentle massage, so Samuel combined Cypress and carrier oil, focusing on upward strokes along his calves and inner thighs. Within 2 weeks, he noticed less swelling in his legs, a sign that his veins were recovering tone, and a newfound confidence that translated into stronger, more reliable results when it mattered most. Samuel credits the blend with bringing back my edge physically and mentally. These stories share a common thread: consistency. Each man committed to a daily ritual, whether morning or evening, and tracked his progress. They measured firmness on a simple 1 to 10 scale, noted changes in sensitivity, and even logged improvements in sleep quality and mood. By the end of their first month, all 3 men saw measurable gains: firmer responses, more predictable performance, and perhaps most importantly, renewed confidence in their bodies. Remember, your journey may look different and results can vary, but by following the same science-backed approach, targeted oils, proper dilution, and thoughtful application, you're tapping into the same mechanisms that drove these life-changing transformations. In our next section, we'll discuss important precautions and when to seek medical advice, ensuring you stay safe as you explore the full potential of essential oils for vascular health. Precautions and when to see your doctor. While essential oils offer powerful support, they're not a substitute for professional medical care, especially if you're managing chronic conditions or taking prescription medications. Before beginning any new topical regimen, always perform a patch test to rule out allergic reactions. If you notice redness, itching, or a burning sensation beyond a gentle warmth, discontinue use immediately and wash the area with mild soap and water. Men on blood thinners or with bleeding disorders should consult their urologist before using oils known to influence circulation, such as rosemary or peppermint. Similarly, if you have diabetes, neuropathy, or compromised skin integrity, seek guidance to ensure massage won't exacerbate any existing nerve or tissue issues. Pay attention to warning signs that warrant a deeper evaluation: sudden changes in urinary habits, pain during intercourse, unexplained swelling beyond mild post-massage, warmth or persistent redness at application sites. If you experience chest discomfort, dizziness, or shortness of breath during or after a massage session, stop immediately and contact emergency services. These could indicate cardiovascular events unrelated to topical oil use. Finally, remember that optimal erectile function is multifactorial. Underlying issues like hypertension, high cholesterol, or hormonal imbalances may require targeted medical interventions. Essential oils can complement but not replace prescribed therapies for vascular health. Regular checkups, blood work, and honest conversations with your healthcare provider ensure you're on the safest path to better circulation and performance. With these precautions in mind, you can confidently incorporate essential oils into your routine, knowing that you're respecting both the power of nature and the importance of professional oversight. Now that you understand how these oils work and have real-world examples of success, it's time to take action. Choose one blend, perhaps rosemary paired with jojoba, and commit to your nightly ritual for the next 2 to 3 weeks. Keep it simple: 2% dilution, gentle massage for 3 minutes on each target area, and a moment of deep breathing to reinforce relaxation. Track your progress on a 1 to 10 firmness scale. Note changes in sensitivity and pay attention to overall mood and sleep quality. If you prefer a morning boost, integrate the same steps post-shower, pairing each application with light stretching to activate your muscles and vessels for the day ahead. Consistency is your greatest ally. The more faithfully you follow the routine, the more reliable your results will become. As you progress, share your journey, whether in a personal journal or with a trusted partner, to celebrate milestones and stay motivated. And if you ever have questions about adjustments, like swapping carrier oils or fine-tuning dilution, refer back to this video or consult your urologist for personalized guidance. Ready to reclaim control over your circulation and performance? Start tonight and give your body the support it deserves. Don't forget to like this video, subscribe for more expert men's health tips, and hit the bell so you never miss an update. Your path to stronger, more consistent results begins here. Conclusion. Essential oils offer a natural science-backed way to support blood flow, calm inflammation, and reduce stress, all crucial factors for reliable performance after 60. With targeted blends of rosemary, peppermint, lavender, and cypress, you have a toolkit to awaken vessels and nerves backed by real success stories and decades of clinical insight. I'm Dr. Henry Carter. Thank you for joining me today. Try these oils, stay consistent, and rediscover the confidence that comes from firm, dependable results. Until next time, take care of your health and remember, a few drops can make all the difference.